arrived on scene, a motor vehicle accident. I have a patient that has been ejected from the vehicle. Suspect his mechanism of injury is being thrown from the car. It appears to be one patient, mid-20s male, appears to be unconscious. The scene is safe. There are no bystanders to provide any kind of sample history. So I'm going to begin my initial assessment. I'm going to check to see if the patient is breathing. I'm going to look, listen, and feel for breath sounds. I can see his chest rising, can feel his breath, and can hear him breathing. Respiratory rate seems steady, regular. Sir, can you hear me? Can you hear me? Does not respond to verbal cues. I'm going to try pinching trapezius. No response to pain. Is unconscious and unresponsive on the AVPU scale. I'm going to direct one of my assistants to hold manual C-spine while I begin primary assessment. Breathing regularly, appears to have a patent airway. Breath sounds are normal. I'm going to check for any major bleeding. No signs of any major bleeding. So I'm going to recommend immediate transport as a high priority. I'm going to direct my second assistant to retrieve the long spine board and the C-collar out of the ambulance. Sir, I'm just going to check you over to see if we can find out what's going on with you. My name is Heath from the ambulance service. So I'm going to do just a head to toe and put my hands on you. You're just going to feel me looking for injuries, okay? Feeling the head. And check the ears for any cerebral spinal fluid. Appears there's none. Check the clavicles, scapula, shoulder seems stable, rib cage seems stable. I'm going to palpate the abdomen. No, everything seems normal, no pain response. Check the hips. Feeling no deformities. We'll check for distal pulse. Got a pulse. Check for distal pulse. Pulse there. Check the arms. Check for a pulse. Can you wiggle your fingers? You feel me squeezing? Check capillary refill. Capillary refill seems normal. This arm, check for a pulse. There's a pulse. Can you wiggle your fingers for me, sir? You feel me tapping? You squeeze my hand. Check capillary refill. Seems normal. Okay, just gonna check for any brachial deviation or jugular vein distension. I don't see any. I'm gonna expose the chest. Look for any injuries. Feel for crepitus. Push on the chest wall. No response, no reaction, no injuries. So now I'm gonna get baseline vitals. So I'm gonna check the pulse. At 40 beats per minute. And check for respirations. Respirations are around 14 breaths per minute, so no need for assistance there. Skin appears to be pink, warm, and dry. Capillary refill was okay, so adequate perfusion, circulation. I'm gonna check the blood pressure. So I'm just going to check your blood pressure real quick. .40 over 82. Just going to check the lungs for breath sounds. sound normal. So we're going to log roll the patient, and we'll put on the C collar, log roll the patient, and put him on the backboard. So my assistant is still holding C-spine, or the C-collar has been installed. Just gonna log roll the patient as a unit and check his posterior. Keep that leg straight. Just gonna palpate the spine, checking for any offsets. See none, no major bleeding, no sign of injury on the back. Back down, 2, 3, go. And we're gonna load him up and take him to the hospital.